finishing up Chapter 5 with Objective 7, interpret the meaning of abbreviations related to the respiratory system. So there are several abbreviations for this chapter. I want you to pay special attention or close attention to what letters are capitalized and what letters are lowercase. So in the first one, ABGS stands for arterial blood gases, just meaning it's plural, but again, the A, B, G are all capital letters, the S is lowercase. And then otherwise, like flu is all lowercase, but pretty much all of the other abbreviations are all uppercase. So be very careful when you're doing your homework, because if you put A, B, G, S in all caps, it's going to count it wrong, and it is wrong. So please pay special attention to that. So I'm not going to go over all of these since most of them we went over when we were doing the terms, but I am going to go through a few more slides with you. So here they want the abbreviation for a radiographic image of the chest performed to evaluate the lungs and the heart. Again, you can pause the recording at any time, but hopefully you answered a chest x-ray, which is abbreviated in all caps, CXR. Then they want the abbreviation for a computed tomography scan, which is going to be CT scan. So here they're asking you, are you familiar with another common way to abbreviate computed tomography scan, which we just did in the previous example, but now you can also do it as a CAT scan, CAT, which stands for computerized axial tomography. So the only difference is they're putting the word axial in the term. What is the abbreviation for the two nuclear scan tests used to diagnose or rule out pulmonary embolism? That is going to be a VQ scan or a lung ventilation perfusion scan. And then just 5 simple abbreviations. I want you to give the term. So again, you can always look in your book for the answers, but TB, tuberculosis, SOB is shortness of breath, not son of a blank. HAP, hospital-acquired pneumonia. COPD, chronic obstructive pulmonary disease. And OSA is going to be obstructive sleep apnea. And your book also has a table 5.2 that is common abbreviations used in the respiratory care department within a healthcare facility. Most of these we did not go over, so again, just take a little bit of time and review those as well. So now, Objective 8, apply medical language in clinical context. Here is the scenario that is in your book as well. We'll read it and then we'll answer 4 questions pertaining to it. So, a 24-year-old man visited the emergency department because of dyspnea, hyperpnea, paroxysms of cough, and the presence of thick, tenacious mucus. He had a history of asthma since the age of 12 years. A chest radiograph was negative for pneumonia. Arterial blood gases showed hypoxemia but no hypercapnia. Pulmonary function test disclosed bronchoconstriction, which was corrected by a bronchodilator. A nebulizer was prescribed for treatment. The asthma attack was probably precipitated by an episode of bronchitis. So now here are the questions. So these are true and false. The patient visited the ED because of many symptoms, one of which was sudden periodic coughing. And that was true. And that would be the term paroxysm that was used in the scenario. Number 2, diagnostic procedures were performed to assist with the diagnosis. ABGs showed increased oxygen, decreased carbon dioxide, and a normal pH. And again, go back to the scenario if you need to. I'm actually going to pause it so I can go reread it. And this will actually be false because they use the term hypoxemia, which is deficient oxygen, and hypercapnia, which is excessive carbon dioxide. So in the question they flip-flopped it. Number 3, an agent that causes the bronchi to widen was used to treat the condition diagnosed with the PFTs, and that is true. And the last one, the asthma attack was precipitated by narrowing of the bronchi, and that is going to be false because it said an episode of bronchitis, which is going to be inflammation of the bronchi. And that will end the recording for chapter